I think we're already on some levels to epidemic proportions within zoos and sanctuaries. There is this one thought process is, well, they can function quite well without any teeth. The dichotomy between working with humans and working with animals, in the sense that animals show you less because of their nature. They'll continue to eat even in pain, because in reality, if you stop eating, then you can get ostracized or killed in the wild. These animals were meant to have teeth just like humans are meant to have teeth, and there's significant consequences. I lean more on the human perspective in this sense, that without teeth, there is a loss of structure. There's a loss of abilities to eat and chew properly. There's health decline. There is mental decline. There's social decline. I think that's inherently the most important thing that we're doing, to give them back the life that they were supposed to have.
Today on the Paws Effect Podcast, we're thrilled to welcome Charles Dyer, a representative from the Dental Coalition for Conservation, the DCC 2025, a unique coalition of dental professionals dedicated to improving the lives of exotic species through advanced veterinary dental care, education, and conservation partnerships. I am excited to explore how dental health plays such a pivotal role in wildlife welfare and broader conservation goals. And before we begin, don't forget to like, follow, and subscribe to the Paws Effect Podcast so you never miss an episode. I'm your host, Dr. Kara. Let's get started. Welcome to the Paws Effect Podcast. I have Charles Dyer here today. Welcome. You are all the way in the US. Is that correct?
Yes, ma'am. Thank you very much for having me.
Such a pleasure. Where are you based?
I'm in Houston, Texas.
Fantastic. And it's 9 a.m. in the morning for you?
It is 9 a.m. Yes, ma'am.
It is 4 o'clock here for me in the afternoon here in South Africa. But isn't it great how we can do this all the way across the world?
Very, very much so.
I love it.
Yeah, South Africa has a very warm place in my heart.
Oh, are you familiar with South Africa? Have you been here?
Yes, we travel there. For the last 5 years, we've traveled there every year during the summer, and we work with Wildscapes, veterinary and conservation services, and we do rhino dehorning.
Fantastic.
So we're kind of vastly entrenched with that, with them, and we'll be planning on doing that again this year.
Fantastic. And whereabouts?
Or actually, 2026.
Next year. Whereabouts do you generally visit? Which part of South Africa do you come to?
Mostly Hot Springs.
Okay. Nice.
Yeah.
Oh, lovely. It's such a beautiful part of the world. Love it.
Yes, we've. I can't envision a time where we won't be visiting every year.
It's a good reason to travel. So we are here to talk about the Dental Coalition for Conservation. What is this? Who inspired the creation of the Dental Coalition? I'd love to understand your place in it.
Well, I think it's kind of born from an idea of several people actually. But kind of my story is I am a periodontist, a human periodontist, so I'm not a veterinarian, but have a lot of veterinarian roots. I originally went to Texas A&M University for veterinary medicine. I really wanted to be a veterinarian, but kind of the shorter story is that, kind of life takes you in different paths and pathways. So I ended up in periodontics. I love what I do. I see patients 8 to 6 Monday through Friday. I have definitely several friends that are veterinarians, and one fateful day, a good friend of mine who's now passed away, Dr. Mark Peckham, who is a veterinarian and for the Houston Zoo for 13 years, he just asked me for some advice on a case that he had on a white tiger that was located here in the downtown aquarium. And I just gave him some advice, and he just said, well, why don't you come out here and do it? And my mind was blown. So I canceled patients, and I went to the aquarium and helped him, and then realized that was something that I really wanted to kind of foster and I wanted to do, and looked up online and found the Peter Emily International Veterinary Dental Foundation, and began doing a lot of work with that foundation, became their president, did public relations for them as well, and then found my way into a conservation space and realized that there just wasn't that component, and felt like there was a a direct linkage or a connection with conservation and what we're doing here with sanctuary and zoo work with dentistry. So we wanted to combine those two efforts, and thus the birth of the Dental Coalition for Conservation.
I love it. So how big is this group? How many team members are part of your coalition?
Well, currently we have a board that consists of veterinarians, board certified veterinary dentists, and people like myself, just general dentists or periodontists. We have a group of people to pull from that we're always pulling from across the U.S. and globally. So this is a type of organization that if you're a dentist, if you're a specialist, if you're a veterinarian, a board certified veterinary dentist, if you're conservation minded, you can be a part of this organization and be a part of this global network of people that are servicing zoos, sanctuaries, across the world in order to kind of do dentistry, teach dentistry, and learn from those that are, more skilled than you, and be able to kind of give back in a sense that from a conservation perspective.
Before we go into more details about this coalition, which is fascinating, and I'm genuinely interested to learn more about it, for the listeners who are just pet owners, let's talk about why dentistry is so critical and why we spend so much focus on discussing dental health and managing dental conditions.
I think even from a veterinary perspective, it's often brushed over. I know within the U.S., I know dentistry itself is not a kind of a topic that's really, really entrenched or discussed. Typically, you learn maybe an extraction or two, and then that's really about it. When the primary function from an animal perspective, food gathering, and this is all kind of stems from the mouth moving downward. So I really would like to teach more of a whole body approach where we're, it's system wide, but we're kind of, starting with the mouth and understanding those perspectives, and then moving down to the systems and how that relates to, worldwide systems. I know from a human perspective, especially in periodontology, we know that there are systemic links of periodontitis to cardiovascular disease, preterm low birth weight, and diabetes. So, these things that they're happening in the mouth are directly affecting systems within the body. So I've seen patients that we kind of, doing a full cleaning of the mouth, and, and their white blood cell counts improve, their overall health improves, their mood improves. So, we're looking at kind of taking it from a whole body system, but realizing that we have to start at the end and then moving downward. So I just don't want there to be this brief overlook of something that's vitally important and then moving downward, where we should start at the mouth and move down.
Absolutely. And I think the difficulty is, even from a discussion point with owners dealing with sort of general practice and small animal practice, which is where the field I'm in, is that it is only sometimes recognized when there is either severe pain or smell, which is obviously not the point you want to get to. And we are trying to, as a practice, become better at discussing preventative healthcare and sort of not ever having to get to that point, but by teaching and being more open about the health benefits, like you say, from a holistic perspective, from all the associations with heart disease and mental well-being and behavior and so on and so forth.
Yeah, certainly. And then therein lies the dichotomy between working with humans and working with animals, in the sense that animals have they'll show you less because of their nature. Exotics, specifically working with exotics, you don't see, they'll continue to eat even in pain, because in reality, if you stop eating, then you can get ostracized or killed in the wild. So, we as humans are much more forthright with pain, in the sense that we're coming in immediately and we're telling you. So it becomes difficulty when working with, even domestics and exotics, kind of delineating those differences and how it affects. So you are correct in the sense that you don't see anything until it's vastly in a one direction, very, very poor. And then we're kind of when we are dealing with system-wide systems, it may have started in the mouth, and then now it's become this system-wide thing because the animal didn't show you immediately what was going on.
So the work that you're involved in is absolutely fascinating for the benefit of me, selfishly doing this for my interest, but also for the listeners. Tell us a little bit more about how varied the work is. Give us an example, perhaps, of like the most recent case that you've had to deal with that involves an exotic species.
Oh, well, I was literally just yesterday morning. I'd seen patients on Monday. I flew to Louisiana, which is about an hour flight, and drove to a place where we worked on a striped hyena. We did an extraction of lower 304, and then we did a root canal on 404. And then, just got back on a plane, flew back, and now I'm back seeing patients from a human perspective here in the office. We primarily would like to work on weekends from a zoo and sanctuary standpoint. We generally have all of our members are, they're private practice owners or they work in clinics. And we really want to respect from the time perspective, since it is a nonprofit and we're doing this all of our own. So, we want to respect those people that are coming from private practice, and we're trying to schedule events on our missions on, a Friday through a Sunday. So we have the ability to kind of work over a weekend. There are several occasions that, sometimes things pop up from an emergency perspective that we have to kind of address. But for the most part, we're trying to kind of schedule missions on a kind of a weekend basis. And that can vary from striped hyenas. For instance, in October, 1st of October, we're going to save the chimps in Florida to work on some chimpanzees. And then later that month, we're working at Aikman Wildlife Adventures with a kind of a mixed species of hyena, kangaroo, and some smaller species that we're going to be working with for a 2-day mission. And then back in November to chimpanzees at Save the Chimps. We are finalizing a mission to Sierra Leone in Takugama to work on chimpanzees. So it can vary from primates to big cats to hoofstock. There's just a lot of different things that come. It's just whatever comes our way, and we're willing to kind of work. That's the beauty of having a global organization in the sense that we can draw from individuals that are, have seen different things and have worked with different species. And so if you're not familiar, we have someone that is familiar that we can get with from an expert perspective.
It's incredible. I mean, and the fact that, you're getting not only interesting cases, but that you're making such a huge impact on these animals.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
So how do people contact you? So what is the situation? How do you come across these cases? Is it that there's an awareness that there is this offering that you guys are interested in putting the word out? Or, I mean, I can't imagine how you come across something as varied as a hyena in one part of the world to chimps in another.
Well, it's been, more of a grassroots effort. We are, we're on Facebook, we're on Instagram. Our website is now live. So we're kind of relying on a network of individuals that are kind of passing information along about who we are and what we do. I'm significantly more in tune with, wanting this to grow into more a global wide organization. We have Chloe Butening, who's the jungle doctor on Instagram. She's our international liaison. So, and founder of Global Protagonists, who, they do conservation work throughout the internationally. So, that's just a really, really huge help. She's a very good friend, very good asset. And then, here locally, we have Jamie Burning, who's a board certified vet dentist, who is highly into education, and she's our director of education and outreach. She's working with, individuals to kind of create kind of a curriculum that we can kind of provide to zoos and sanctuaries, across the world to better understand dentistry and for us to teach dentistry better. Because we are coming from a perspective in the sense that we need to teach, not only board certified veterinary dentists who are kind of still learning maybe exotics and understanding that aspect of it, but we are teaching veterinarians dentistry that may have never seen any type of dentistry. We're teaching lay people like myself, like a human dentist, veterinary dentistry, which is different. The skill set of dentistry is the same, but obviously anatomically things are different. And I'm one of the biggest proponents, being a human dentist or periodontist, for an advocate for having board certified veterinary dentists or veterinarians very skilled in dentistry on board with togetherness to kind of create this coalition that better helps everyone involved.
So you've recently adjusted, and there was a mention of a new mission, a new purpose. What is that all about?
Well, generally from a past perspective, working with the Peter Emily Foundation, it was more about just kind of, working in that space, working within the dentistry space. And in going to mission work in South Africa and doing rhino dehorning and, translocations and those types of things, I just felt that there was this ability to use this platform for greater conservation work. And that aspect of it within the Peter Emily Foundation, we just didn't have. So I felt like there was a need within myself to do that. So our mission not only is to kind of do veterinary dentistry and to teach veterinary dentistry, but we want to use that as a platform to then move into conservation space and to really, really kind of combine those two things to let people know that, yes, this is one aspect of veterinary medicine, veterinary dentistry, but that aspect is so important that it can affect global conservation, that we can use funds that are brought to us in support to fund global conservation projects. So I think that's really, really important. And it's just something that I really wanted to see as I have grown older and aging. I felt like there was just this need to really kind of put a footprint on what we were doing.
I love that. I mean, I do want to understand, and please excuse me if it's a really stupid question, but I'm going to ask it anyway. I'm going to put myself out there.
No.
How do you explain the value of stepping in with dental treatment when some people will see the whole survival of the fittest as a reason to avoid intervening with wildlife health?
I mean, it's a very good question. On one end of it, from a wild perspective, you actually don't see a lot of dental disease because we're understanding diet capabilities and those types of things within kind of a zoo sanctuary type of setting. So in the wild, beyond a lot of trauma, you're not really seeing dental pathology, dental caries, periodontal disease. Those things are kind of not seen. What you're seeing is within the captive population of zoos and sanctuaries, we are seeing dental pathology. We are seeing, trauma from cage chewing and fracturing and, fracturing of teeth. We are seeing periodontal disease and dental caries from poor diets, maybe coming from a private ownership perspective and then moving into a sanctuary or moving into a zoo with better diets. It was said that this was from Dr. Peter Emily, that this is a human problem and that there has to be a human solution. So the question from a kind of a wild perspective is different than versus a zoo sanctuary perspective, maybe even different than even kind of a small animal or, a private practice type of perspective, and how you're approaching those different things and how you're approaching dentistry and all those different modalities.
No, that definitely defines what you're doing. And I think a lot of the education has obviously got to be from managing the immediate problem, preventing sort of recurrence or managing the ongoing problem, but also then an education opportunity going forward to like you say, diet, cage design, general sort of interaction and enrichment. This is more than just fixing the issue at hand.
Yeah, certainly. And not only are we just doing a treatment, but we're also educating in the sense that, okay, well, here are ways to improve. Obviously most of the zoos and sanctuaries that were, if not all, are all accredited, and they're doing really well. They're managing space. They're doing what they can, but most of these animals kind of influx are coming from, at one point in time, private ownership or just poor care. And we're delineating when we're kind of fixing that aspect of it and moving forward. So yeah, it is about a whole health education.
You talk a little bit about some of the workshops and the mentorship and partnership opportunities with the sanctuaries. Tell us a little bit more about that.
We do have zoo partners and sanctuary partners that have been, quite consistent with work. We're working with those sanctuaries and zoos kind of consistently. We're always looking for more partners to kind of, extend our reach. But it's important that we, have consistent work so that we can consistently teach. If we're not seeing those partnerships, then obviously we're kind of, relegated to one aspect, maybe doing a wet lab or trying to do some type of kind of lecture of some kind. But it's not in substitute for hands-on, boots on the ground work and conservation. So, it's important that we have as many partners and as many sponsors. So we're not limiting those aspects of it. And what we'd like to do is be able to not only provide work, but provide monetary value, provide, a lot of our dentists in the area have donated the gloves. They're donating a lot of ancillary items, so we can move those into sanctuaries that we're partnered with to help. All of our primate sanctuaries get, if they're from higher primates like chimpanzees and those types of things, we're providing toothbrushes for enrichment. So they cannot, there may or may not be taught how to brush teeth, but they're kind of using that as an enrichment tool to help. So, we're trying to do the best that we can as a nonprofit to not only provide, but to give back, not only from a dental perspective, but from kind of a whole health perspective, and to kind of fund their ability to do more as well. So it's just kind of this symbiotic relationship of providing to them so they can provide to us.
It's incredible.
Well, I mean, in the sense that they need us, there's a point in time in all sanctuaries and zoos that, there's just not a need for dentistry. Everything's going really well. There's not, beyond maybe the one-off trauma of some kind, but, they're doing really well from a diet perspective. They're doing really, the hope is at some point they don't need us. But until that day, I'd like to have as many partners in many areas that we can. Very
much so. You say the hope is that you don't receive those phone calls, except if it's a traumatic event. So
certainly,
give us an example of one of your more challenging cases and explain, obviously, when you're dealing with your patients in your private practice, it might be a lot easier to explain what you're going to do and manage their behavior and expectations.
Oh, certainly.
Tell us about some of the more interesting cases that you've handled and dealt with.
Oh, I think there's a lot of people that within the organization have their animal, their dream animal they've ever wanted to work on. Or for me as a human dentist, early on in this type of work, I really, really, really wanted to work on a male silverback gorilla. So something, quite massive, but having the same dentition. We have the same numbering system from a dental perspective. We have the same, anatomy. The teeth are bigger, obviously, but we have the same anatomy. So it was always just really intriguing for me to, coming from having worked on a lot of big cats and different anatomy and different numbering systems, to get put in that position where it's like, oh, this is a lot of familiarity with me, but on this just massive animal. And I was able to work on a male silverback. So it was just a wonderful experience. And also lowland gorillas. So I'm kind of fond of primates solely because of just the position that I'm in. But I will say working with big cats is emotionally charging. It's a kind of a soul enrichment for me. To see an animal of that size and of that stature and kind of the majestic, quality of say a tiger or a lion, and being able to provide a service that really helps them in a way that improves their captive life. We're not returning them to the wild, unfortunately, but we're giving them a better life than what they had. So that inherently is the most important thing.
I can imagine the work you do must be absolutely thrilling. I mean, just imagining dealing with anesthetized big cat, or I'd love the opportunity, and I'm a vet, so I get it. Let's talk about the impact this has on conservation as a whole, and in terms of whether it's be breeding programs or whatever, in terms of the longevity for these patients.
Oh, certainly. Well, I mean, what we're doing, ultimately is extending life. There's no really way around that. That's the primary goal, is to give them something that they have not had. And that is a better life, a better ability to eat, a better ability to socialize. So, these things kind of extend wide range. We're looking at a kind of a small subset of a population of animals in, say, zoos and sanctuaries. And, we want that to then, have the ability to jump to a more global perspective and looking at, broader conservation work and how that applies, even if it's not dentistry that we're solely looking at from a conservation perspective, but this is a platform which gives us the ability to jump to a conservation perspective, and working with, like a sanctuary like Takugama has a much larger aspect of land availability for their population, and the intake of wild chimpanzees that from attacks on bushmeat and orphaned chimpanzees, and kind of rehabilitating and sending those back into the wild. So from that aspect, we do have a direct linkage to conservation work in those types of settings that are then rehabilitating for the wild. And that's kind of what this launches into. From a global perspective and a conservation's perspective, is our ability to kind of do certain work, dental work, and then have that be able to be then used as a kind of a tool to get them to a rehabilitation state and their ability to then return to the wild. Unfortunately, from a greater perspective, we are working with a captive population that we cannot do that. And that's disheartening. But we have to kind of think of that as one subset, and being able to use that knowledge and use that ability to the second subset.
Very much so. I understand. In terms of some of the signs that you are teaching in order to try and recognize that there's a problem early on, take us through, because I know that this will apply to my listeners who have cats and dogs at home. Tell us about some of the signs that may indicate that there is dental pain without necessarily being able to examine or have a look, because we do have dogs here in South Africa that wouldn't even allow you to touch their mouths, let alone look inside. So what are some of the signs?
And that's a great question, because we rely heavily on zoo and sanctuary owners, techs that are there, animal care staff that are there, that are kind of understanding animal behavior and looking at animals from a daily basis and seeing changes in behavior. Some of these obviously are taught to kind of have, positive behaviors in which they will come to the front of the enclosure and, have examinations, and others, they're far away and they're standoffish and they won't. So you have to look for subtle signs. I will say that primarily not eating is not a really kind of a universal sign, because as we discussed before, most animals will continue to eat even in pain. So you're looking at kind of the subtleties. You are losing some of the obvious things from a facial perspective, looking at swellings or kind of lopsidedness. You maybe notice a swelling on one side, drooling on one side or the other. I guess, yes, not eating, but that's kind of a later thing. You will notice favoring of one side versus the other, kind of the scratching or a pawing on one side or the other. So there's some subtleties in the sense that, something is a little bit off. And And therein lies the challenge of working with, say, an exotic population in zoos and sanctuaries, is that, it is kind of a subtle sign, which you then have to then kind of weigh anesthesia concerns and anesthetizing the animal, and then having it down for something that may or may not be dental related. But then having a unit there that's able to then triage and take dental radiography and then treat as needed. So it is, I liken it to like a MASH unit, in the sense that we have an idea of what might be going on. The animal is anesthetized, brought to us. We do full dental radiography, and then we then assess priorities from an anesthesia perspective. How much time we have to work, and then what are the priorities here? What can we finish within, say, an hour, 2 hour perspective, and then we move forward. The great thing about working with large carnivores is that you can have multiple hands in the mouth. So you can have 4 operators in the mouth working on all 4 canines at the same time in concert, if you work well with one another. So there's a lot of work that can be finished in say one sitting, depending upon the size of the animal and so forth. So, but that's the great thing about it. For me, it's the beautiful thing about it, is because we're getting people that, and we're teaching in that sense that we're working with kind of a large animal, but being able to do a lot of work.
Yeah. And I mean, this can, when you're talking exotics, this could be from very small exotic species to very dangerous large. And you made mention of, working with rhinos. Give us some of the examples of some of the species that you have worked on, or that the team have been exposed to.
We've worked with as small as rodents, all the way up to, there's people within the organization that have worked on African bull elephants, doing vital pulpotomies on tusks and those things. So it just runs the gambit. I myself have worked with a variety of primates, a variety of big cats, smaller cats, domestics, cats and dogs. Let's see. There's some birds in there that we've done some beak work. There has been, it runs the gambit. Done some kudu and nyala. So it's everything. That's another thing I find so fascinating about it. And one of the hardest jobs of a veterinarian, in the sense there's that difference in the sense that human dentists, we work with one species. And we know a lot about that singular species, and that gives us an advantage in that realm. But as veterinarians, having to understand and know, literally every species, depending upon what your scope of practice is, I mean, it's quite the challenge, because everything that can come in is a little bit different, and numbering systems are different for different species and different animals. So that is a significant challenge, and I tip my hat to most of my colleagues that's just an amazing thing to do.
I can't imagine the work that you're doing. I mean, even within the work that we do, just in sort of small animal practice, dealing with the brachycephalics and the crowding of the teeth and the short-nosed dogs, and then that for us is enough variation. So it must be absolutely incredible to be faced with something tiny up to something as large as an elephant.
Yeah.
Talk to me about.
There's a lot of our board certified vet dentists that are kind of working with brachycephalic breeds and kind of doing some preemptive extractions to kind of allow permanent dentition to kind of come in a little bit better. So there's that aspect of it. Incredible
work. So fascinating. You're really inspiring me to take more interest in some of the dentistry stuff, rather than just like, oh no, this is going to take a long time.
It's all right. That's what we're here for.
So explain for me and the listeners a little bit about the process. So, from receiving information, how do you go about selecting the team, who's available, who's going to do the anesthetic, do the work, and then the aftercare?
So as a whole, the foundation is we want, or actually, let me rephrase that. The foundation has made a kind of a decision that we're working with zoos and sanctuaries that provide the anesthesia. So ourselves are not providing anesthesia. We really want to be focused on the dentistry and do that really well and be able to teach that really well. without having the concerns or worries of doing the anesthetic component. So we're working with zoos and sanctuaries. It's kind of one requirement is that they must be able to provide adequate anesthesia for our procedures. Is generally what we'll have an announcement of a mission, either with Instagram or all of our social media, and we'll be fielding phone calls and from people that are interested, taking resumes, and then kind of working through those, who's worked with us before, who hasn't worked with us, skill set, those are things, and looking at what the mission entails. And it's primarily dictated by the size of the sanctuary. There are some sanctuaries that we work at that are quite small and just don't have the capacity to have kind of a larger group come. And there are some that have. So we work with those different sanctuaries and look at numbers and see how many people we can bring, and then also how many people that we can teach adequately. So that really kind of plays into our abilities. So it's, we're usually kind of working with two skilled operators that have been, and then we try to bring as many students as we can. That could be 1, that could be 4 to 5. So we always have 2 people that are kind of working, that have worked well together in the past, or kind of on an upper level that they've been doing this for quite a while and that are able to teach and have people get involved with the work. That's our biggest thing is I don't want people to sit on the background. So if they come to one of our missions, they certainly can't expect to be hands-on. And we try to do that as quickly as possible in a way that, services the animal and kind of works well with the group that's there.
Yeah. And often at that point, there's a lot of collection of other things, whether it's blood samples, hair or whatnot. So it's can be a big...
Certainly. Yeah. That's why I wanted the coalition, or like we wanted the coalition to be not only just, yes, it's dentistry focused, but, on these missions, you kind of a practitioner can come and can expect to see a lot of other things. They can see anesthesia. There are blood work panels going on that are taken. There's, ultrasounds that are going on. Sometimes cardiologists are there and taking sonograms that are, everything's going on in a concert. While we're working in the mouth, there's a lot of other system work that's going on. So our, mission attendees will have the availability or the ability to see a lot of things going on. So I think that's a kind of a big draw for some of the mission work, and it's not just dentistry focused, but it's dentistry heavy, but it's also, you have the ability to see other things going on. And when our treatment may last like an hour, but there's some other things going on, those attendees can stay throughout and look at everything going on for the animal.
Now, the obvious question, you're dealing with the bitey end. Have you ever had a situation where things have been a little bit hairy in terms of managing that?
Well, I will say first, luckily, no. We work with some great teams of anesthesiologists. We're working with most, if not all of our zoos and sanctuaries have really, really well managed care staff and veterinary staffs. There's never been really an incidence of anything going on. We've had, there's been some things that have gone on where anesthesia may be light, or we're noticing things on the bitey end that could affect the overall health. We're noticing color of the gingiva, or like, hey, maybe not oxygenating well, or we're noticing a little swallowing or tongue movement. So we need to kind of, increase anesthesia. But we're very, very cognizant of anesthesia time, especially in large carnivores. They're prone to hyperkalemia with greater anesthesia time. So we just kind of a set working time, and we're working in concert with the anesthesiologists and really, really, really focusing on, okay, how much time do we have? What can and cannot what can we do? What can't we do? This is what we've done. Do we have time to do any more? And if anesthesia says no, it's not possible, then we just say, okay, the priority here is the safety of the animal and the animal waking up. And, we often say, I'm not worried about the animal being sedated. We're more worried about the animal making sure the animal comes back up. So I'm not worried about them not ever waking up during surgery. I'm worried about the final procedure and them waking up and making sure that's the safest possible. So we are definitely working within parameters. As far as like kind of frights or scares, we've had a couple of chimpanzees that kind of react to, like, we're removing a throat pack and we're spraying down at the last in the water. They kind of ingest a little water. They have kind of they have a reflex reaction of kind of sitting up a little bit and then kind of coming back down. That's, that'll get your heart racing a little bit. But otherwise, no, it's quite safe. We are not allowed really. We try to make ourselves scarce during that process, during darting, during induction, making sure anesthesia has, nice room to work, and them giving us the okay to kind of move in and start working in the mouth and coming back out. So, yeah.
Very lucky. Good team you've got there. In terms of, for the benefit of my listeners, can we discuss the importance of dental x-rays and why you need that information?
Oh, yeah. I often, when I lecture to vet schools within the U.S., I say, would you ever trust your dentist to do any work without a dental x-ray? And some are just like, no. It's like, well, I don't know that I would, trust it. So you having that information, you should understand that the importance of dental radiology. And, what we're getting from a veterinary perspective is a lot of cranial shots, and you just really can't delineate dental disease that way. I mean, you can see some gross big things, but you can't really kind of diagnose specific things. So it's inherently important that we are doing what we call a COHAT, comprehensive health assessment and treatment, which involves dental radiography and taking dental x-rays to understand what's going on within the mouth. A cursory exam does one thing. Looking at teeth is one thing, but looking at it from a radiographic perspective and then combining it with the clinical diagnosis, that is what is inherently important. It's not only important within the human perspective, but it's definitely important within the veterinary perspective, because there are radiographs that I've looked at from a human perspective that differ what the clinical diagnosis is. You can look at bone loss within the radiograph, but have good clinical attachment. And so you can't base your diagnosis solely off a radiograph, nor can you base your diagnosis solely off clinical. You have to combine those two. So it's vitally important to have accurate x-rays. And then within dental treatment itself, it's vitally important because we're doing endodontic procedures that require serial x-rays of different set times within the procedure to understand where your file is, where your master file is. Did you get a good fill? Are there voids? Do you have to compress? So you're having to take those serially to kind of understand and get a good outcome. So it's if not the most important thing that you're doing is taking dental radiography accurately.
Great explanation. Let's talk a little bit about antibiotics and the use of antibiotics, particularly in animals. We are obviously encouraged to try and manage our use of antibiotics, to take swabs, to send away for culture and sensitivity. How are you managing those sort of situations, particularly if you say, like, for example, abscesses or situations that need it? We are, I come from a different world in the sense that as a dentist and as a human perspective, we're blanketing every single surgical patient with an antibiotic. So I approach it from that perspective. And I will say a lot of antibiotic use within the human world is more for liability than it is for, the need. If you were to remove a tooth and clean the site and have a good surgical site and using, sterilized instrumentation, then the need for antibiotics generally probably isn't necessary. But within the U.S., and I would say probably globally within dentistry, human dentistry, that if we were to have some type of complication, the first question they would ask is like, did you prescribe an antibiotic? And if you didn't, then it becomes quite problematic for you. So I blanket antibiotic use for every patient, and I would say almost every human dentist would do the same. In the animal world, there is this kind of this controversy in the sense, do we prescribe blanket antibiotics? Do we not?
I will tell you it's kind of 50-50. I leave that up to veterinarians in charge. I'm a big fan. If they say, do you think that needs one? I would say it does, because we're dealing a lot with abscess teeth. Even though we're removing the diseased portion of the tooth or we're removing diseased nerve tissue, the idea that can infiltrate into a bony perspective is high. So I would think, using antibiotic therapy post is always a positive thing. That's going to differ between, what you're doing in a domestic practice. It'll differ than what you're doing because it's definitely 100% easier to give antibiotics to domestics versus it is trying to give it to an exotic population where it could be quite challenging in order to deliver antibiotics, whether that's through oral use or through injection. Those things play into the role of antibiotics as well as how well and how effective can you use that in a population. There are some that you would like to, but you just physically can't. They're not going to take it orally, and they're not going to be able to use it from an injective standpoint. So again, that's another kind of thing that you're working with veterinarians and working in veterinary medicine. Those are the challenges between the kind of these different fields, is being able to adequately use your knowledge and use your ability to domestics versus exotics versus even a wild population. So it's challenging.
Yeah, sorry. It was a question that we discussed quite a lot in terms of use of antibiotics.
Oh, certainly. Certainly. I wish I had this great physical this is the 100%. This is the answer, but there's just not one, and I haven't seen one in my career yet, and I don't know that there was going to be this hard definitive line, because you in your field and from a veterinary perspective, you are working with if you're working with domestics versus working with a captive exotic population versus working with a wild population, the ability to deliver antibiotics differs on all those. So it's quite challenging, where in my field, it's, you're giving it to another human being. You're like, just, take your antibiotics, and they have the ability to take them or not. So that's up to them, but they're given antibiotics for a purpose. Yeah. So.
And the other question we often get asked is, during this dental procedure, could you remove this lump? Could you manage this wound? Could you do a spay, which is obviously, a routine abdominal procedure? What are your feelings on combining dentistry work with other procedures? Because I appreciate with what you're doing, this is a one chance opportunity, but for us, the fear is multiple or costs associated with multiple anesthetics.
Right. I will tell you, from working with exotics in a captive population, there is a push to do as much as possible. So I have seen, while doing dentistry, I have seen spay neuter done at the same time. I have seen the dew claw removal at the same time. Like a pad removal. I've seen a lot of different things going on: lump removal, mass removal, allergy testing, ocular exam. I mean, I've seen it all, just because they understand that there's a possibility that this animal may never be anesthetized again. So let's do as much as we can. Let's do, for the animal. So, within reason, we're not doing massive surgery here, but I mean, some of those smaller things I definitely would agree with. Let's say the chimps, they're doing, they have a cardiologist there that's looking at the heart. They're doing ultrasounds. They are also doing preventative measures for, let's see, I'm trying to see their list of symptoms, but they're doing a lot of things at the same time that this chimpanzee's down, because there's a possibility the chimpanzee, from a familial perspective, from a group perspective, age perspective, that may not be able to be anesthetized again. So I think in that realm, it's very high. Now, maybe in a domestic realm, it's not, because domestics you can kind of put down much easier, and you can do separate time periods. But from a captive exotic population, I think even in a wild population, they're trying to do it. They would do as much as they can physically. I know when we do rhino work, yes, we're dehorning, but we're also, if it's a new animal, we're also notching ears, taking blood, putting microchips. We're doing as much as physically possible within a 15 to 20 minute time frame that the animal's down to animal coming up. They're doing as much as they can in order to kind of better track the animal, better visualize the animal, those types of things I think are vitally important.
You made mention when you were talking about the chimps about protecting the airway. Explain to the listeners why you have to do that, and you don't have an issue, obviously, when you go and see your dentist and you can use suction. Explain the importance of an ET tube and managing airway.
Our procedures, dental procedures, are usually lasting about an hour to 2 hours, depending upon how much we're working on. So, trying to manage that with just injectable drugs alone is quite challenging, and from a species perspective could be absolutely nightmarish. So we if not always, had to have an ET tube placed, so we have adequate gas anesthesia, so we can keep the animal properly anesthetized. It also occludes the airway for us just a bit. Well, we use throat packs, so nothing kind of go down the throat. But without gas anesthesia, it becomes inherently challenging to then manage, not only from an anesthesia perspective, but from a dental perspective. There could be involuntary movement during, some types of inductions and some types of injectable drugs. There could be masked signs and symptoms, whether the animal is, doing poorly perfusing or not. So, having monitoring from a gas anesthesia perspective, an ET tube, having, CO2 monitors and those types of things, those are all kind of inherently vastly important.
Mm-hmm. Before I lose the opportunity to ask you,
sure.
Why, the why, what are the consequences if dental disease in these animals goes untreated?
Well, I think we're already on some levels to epidemic proportions within zoos and sanctuaries. There is this one thought process is, well, they can function quite well without any teeth. I know in small animal medicine, you've seen dogs and cats with no teeth, and they continue to eat, and they're just perfectly fine. So some may say that's acceptable. I just don't know from that's the way that we're supposed to approach it. These animals were meant to have teeth, just like humans are meant to have teeth, and there's significant consequences. I lean more on the human perspective in this sense that without teeth, there is a loss of structure. There's a loss of abilities to eat and chew properly. There's health decline. There is mental decline. There's social decline. And those are all viable reasons, even within the animal world, to want and to be able to provide this type of service. So we have the ability to kind of improve those aspects. We may anthropomorphize or move humans into like this, well, animals should have these same feelings, but I really inherently think that they do. And I think that's vitally important to kind of even show outwardly to the public when they're going to these zoos and sanctuaries and viewing an animal. They're looking at an animal that you would flip open a textbook, or they've seen on a National Geographic show, or they've seen, and it looks exactly the same, and not say, well, why is he missing teeth? What's the deal with that? So just from a, general public view is, you want the animal to be observed in a way that it was supposed to be in the wild. And I think that's inherently the most important thing that we're doing. One of the most important things is, is to give them back the life that they were supposed to have.
I love that. Such a welfare consideration there. What are your hopes for the future of this coalition? Are you hoping that it grows? Are you hoping to get more team members?
Oh yeah, I would, my mentor within this space was Dr. Peter Emily. And when he passed away, he wanted a kind of a faction of his organization in every single continent. He wanted the ability to kind of reach out and say, okay, well, we have members over here. We have members in Africa. We have members in Australia. We have members in India and China. We have members here that we're just not the one sole group in the, say, U.S. traveling to all these places. We're like, we can call different members and say, hey, we have the same abilities. We have the same desires to teach. We have the same desires to kind of reach into conservation space, and we have equipment, and we can mobilize much faster. So yes, I'd like the foundation or this coalition to grow into a manner at which we are able to mobilize quicker, without having to say, like, can we schedule it on this time because most people are available here. So the ability to mobilize quicker, the ability to provide more. If the more members we have, the more reach we have, the more we have ability to kind of pool monies coming in from a support perspective to then reach like significant global, not just providing, say, gloves to a sanctuary or toothbrushes to primate sanctuaries, or, a little bit of dollars. It's providing like large grants of like, okay, here's this is what we're going to provide to you. Or like, this is the equipment that we can then purchase for you to have locally over here. So when our members go, it's right there and we don't have to bring equipment there. So there's a lot of different wants and wishes that I'd like to have, that I will be striving for until I can't do this anymore, which is going to be a long time. I'm 50 right now, so I'm hoping to have a lot more time. I kick myself for not doing this, not doing the coalition sooner, but just not finding this. I wish I was younger and had this. So I'm doing everything that I can now to leave a mark within this space. This coalition, the people that are in it, want to do the exact same thing, is to leave a mark within the conservation space. And for us to then, when we pass it along to people that are much the same, that can then continue to see this grow. And, because we are realizing that, most zoos and sanctuaries most of their dentistry is done by veterinarians and or human dentists. So it's not done by a board certified vet dentist. So we need to kind of be able to understand that we're teaching that population and being able to kind of further that population to kind of then do really good veterinary dentistry.
Mm. And I mean, you made mention this is an NPO. If any of my listeners feel inspired, yes, and they want to help, what are some of the ways that they can make a difference?
Oh, certainly. Obviously, for every organization, you can donate monetarily if you don't have the ability or the will to kind of like be able to kind of meet us. But yeah, so there's ways to donate on our website, and then of course we want people that are of their time. So if you're available for mission work, there is no cost to mission work beyond just your own room and board. And at some point in time, we'd like to be big enough that we're providing that for our members. But there's no tuition fee or of any kind. We just want you as a person who has the ability and the will to want to learn dentistry and to want to help animals within zoos and sanctuaries and globally. So we're going to take all comers that want to learn. And I think that's the most important.
Very much so. And obviously those who are listening, pet owners out there, they're just sharing the podcast, getting more awareness around the work that you're doing is helpful, even if they're not in a position to financially donate. Every little bit counts. And obviously that is support.
Certainly.
And we hope that you get a little bit more sort of awareness, and the more that you do that, hopefully the bigger and the better and the more work you can do out there, which is it's totally inspiring for us little vets in private practice.
Well, thank you. I'm very lucky and blessed in the sense that I'm working within a profession that has allowed me to do this. It has allowed my wife, who's our managing director, to kind of co-founder of the coalition to do this. But I truly get enrichment from that, but I also get kind of a soul-filling enrichment with every mission that we're doing, because it's really, really important to me, and working within this spaces and meeting so many people that are of the same ilk or the same mindset, that are just so focused on establishing good oral health or mental well-being, or different aspects of veterinary medicine. It's just those people are just so fascinating to me.
And we will include, obviously, in the notes, but tell my listeners where they can find more information about the work that you're doing.
Oh, certainly. You can go to our website. That's at the-dcc.org. Or we can go to our Instagram, which is at the DCC 2025. Or you just visit us on Facebook with the Dental Coalition for Conservation.
Thank you so much for taking the time today, Charles. It's been really fascinating to hear what you're doing. I'm certainly going to be following the work.
Thank you for having me.
It's been such a pleasure. It's fascinating, and it's obviously very inspiring for us all just to give back in ways that we can. So I wish you all the best, and hopefully when you come visit South Africa that you get in contact. And we certainly have some phenomenal vets who are interested in dentistry, but also in conservation work. So it'd be good to
absolutely. I would love that. Yeah. I would love that.
Oh, well, thank you, and good luck to the rest of your day with your human patients. I hope they behave very well when you see them. But thank you. I know that you've taken time out of your busy schedule. It's been great.
Oh, no, I appreciate the time. Thank you very much for having me.
It's been such a pleasure. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can I get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.